Today we will discuss about basic life support or BLS. It is a much needed topic which you have to encounter in daily life. Now we BLS mainly it is given for cardiac arrest patient. Cardiac arrest patient. Okay. Cardiac arrest patient. Now see what it is. Uh, in case of cardiac arrest or there is many not cardiac arrest, some pulseless activities in body, pulseless condition where you can't feel the pulse. Okay, this is ventricular fibrillation, ventricular tachycardia. It can be monomorphic or polymorphic. It can be pulseless electrical activity, and it can be asystole or asystole. So there is a, mainly these four conditions. We will discuss about it later. Now, you are going through a road and see a patient or any person suddenly fall down, and you are a doctor, and or you can be a common man. Common man, you go to the patient side and feel for something. Mainly two things. If there is any breathing of the patient, breathing, and feel for the pulse. Which pulse? Mainly carotid pulse, as it is lost at last. You may not feel the mainly radial pulse in many conditions, but carotid pulse is the pulse which lost at last. So you have to feel about this. Feel the carotid pulse. Now, if there is breathing is present and pulse is also present, nothing to be done to the patient. Only you have to move the patient to lateral decubitus so that the patient is not aspirating anything. Okay. Now second condition where pulse present but breathing absent. So you have to give only breathing support, nothing to be deal with pulse. Okay. Now the last condition is most dreaded. Pulse absent and breathing is also absent. Then you have to give the cardiopulmonary resuscitation CPR. Okay, CPR. Now, CPR, you know there are some basic steps. 30 is to 2. What is 30 and what is 2? 30 is chest compression and 2 is the rescue breath. You have to give 30 chest compression and 2 rescue breath. Okay. Now, in 1 minute you have to give 100 to 120 chest compression and 8 to 10 breaths in case of adults. In case of child you have to give more breaths. Okay, that is 12 to 20, but chest compression rate is like this. Now see, sorry, how the chest compression is given. Okay, look at this video, sample video I have. Let me. Okay, now see, this is video. Look at my hands position. Look, and the fulcrum should be your pelvis or your hip joint, and like this you have to keep chest compression. Okay, now adults you have to give, I have said 30 to 2, like if there is 1 or 2 rescuer, and in case of pedia or child 30 is to 2 if there is 1 rescuer, or 15 is to 2 if there is 2 rescuer present. And in case of neonate that thing is quite different. I have to give 3 is to 1, and 2 rescuer is mandatory for neonates. Okay. Now how much you have to depress the chest and where you have to press. See, it is a symmetry diagram. I am showing a patient in this is a patient of mine, and it is his tummy and it is a leg, and like it is his chest region, and it is his GP sternum. We have to press over here, press over the lower 1/3 of the GP sternum. In case of adults it is 5 semi, and in case of child 1/3 of the chest circumference you have to press, and you have to just allow the chest to recoil. Don't give it in a hurry that 1, 2, 3, 4, not like this. You count in your mind that 1001, 1002, 1003, 1004, like this, okay? And don't and never break your uh, break your arms, okay? It should be straight, and so the all the pressure of yourself will be over the patient's chest, okay? If there during CPR some ribs may be broken, but you have to continue with your cardiopulmonary resuscitation. And cardiopulmonary is over pulmonary. If you are in a road, you have to give mouth to mouth breathing, not uh, by opening your mouth with and head, the patient head should be tilt and chin should be lift, and you have to pinch the patient's nose, and give the rescue breath by mouth to mouth, okay? So now the it is pulse absent, breathing absent, CPR 30 to 2, and you have to give it for 2 minutes, and then let's check pulse again and go back to your CPR within 10 seconds, okay? Go back to CPR within 10 seconds, and if you are exhausted and if you have any companion of you, then he will give the CPR and you chest compression, and you have to give the rescue breath, okay? Now how long you should be given it? In India it is not available so much, but in case of USA or UK, or if you deal with a patient in airport, you may get the AED, automatic external defibrillator, and you have to bring it as soon as possible. Whenever it is available, give, uh, give it to the patient. One should be at the, let's suppose it is the clavicle, sternum, okay, and here it is the heart. One you have to give, it is the nipple of the patient. You have to give one of the in the right side, one patch, and the left side here, okay? Then connect with the AED machine, and the machine will tell, will read the pulse, and you have to, machine will say it is shockable rhythm or non-shockable rhythm. If it is shockable rhythm, give the patient shock, or it is non-shockable rhythm, you have to continue with your CPR, okay? Now the shock range is 200 joule at an average, and it may differ, okay? Now you are a doctor in your ICU, and what should be your position? Suppose it is the bed of the patient, you are the team leader, you will be here, and here will be the persons mainly, who will give the CPR to the patient. Here will be a person at the head end who will give the breathing support to the patient, and here will be the staff nurse who will check uh, for IV care, who will give the IV cannula to the patient, or ABG, okay? They will do like this. Now the basic thing is over. Now you will, if the patient is in ICU, do the further management by doing ECG or anything. If you deal with the patient in outside, after giving the AED or CPR, you have to send the patient to nearby hospital, okay? Now in the next video we will talk about ACLS, or advanced cardiac life support. Thank you.